Hey guys, in this video, we're going to walk through a clinical case that honestly trips a lot of people up, but once you get it, it's one of those diagnoses you won't forget. So yeah, let's just jump right into it. So we've got a 38-year-old female, and she comes in saying, I've got these painful sores in my mouth that just keep coming back. She says they've been happening for like the last 8 months. Each time they last a week or two, they heal on their own, and then they come back again after a few weeks. She also mentions some genital discomfort, but doesn't go into much detail. And more recently, she's had a little bit of blurred vision. Her physician actually referred her for evaluation because of how long this has been going on. All right, so on the exam, we see multiple round ulcers, about 1 to 2 centimeters in size. They're on the buccal mucosa and soft palate. They've got like this red halo around them and kind of a yellowish center. There are also some healing spots on the lower lip, but there are no vesicles and nothing that looks like fungal infection, like no pseudomembrane or wipeable white patches. And the ophthalmology report, it mentions anterior uveitis. Okay, so what's going on here? Let's go through the options. First up, we've got recurrent aphthous stomatitis. So yeah, this can totally look similar. You get those painful round ulcers with the red border and yellow center. But the thing is, aphthous ulcers don't usually come with genital lesions or eye problems. They're usually limited to the mouth and there's no systemic involvement. So uh, while it kind of looks like it, it doesn't explain the full picture. Next, we've got pemphigus vulgaris. That's an autoimmune blistering disease, and it definitely affects the oral mucosa. But you'd expect to see like bullae or erosions and a positive Nikolsky sign where the skin peels with slight pressure. And the onset is more aggressive, not really this waxing and waning pattern. Also, pemphigus doesn't usually cause eye symptoms or genital ulcers. So, yeah, doesn't really fit here either. Then we've got herpetic stomatitis, and this is one people often jump to when they hear recurrent oral ulcers. But herpes usually shows up as clusters of small vesicles that burst and ulcerate. It's super painful, especially the first time, and it's more common in younger patients. Also, the episodes don't usually keep recurring for months in this same consistent way. And again, no genital or ocular involvement here. So I'd rule this one out too. That brings us to Behçet's disease. And honestly, everything lines up here. We've got recurrent oral ulcers, we've got genital symptoms, and now we've got eye involvement, specifically anterior uveitis. That's like the classic triad for Behçet's. It's a chronic multi-system inflammatory disorder, and it can show up with all these mucocutaneous lesions, along with ocular and sometimes even neurological involvement. The ulcers look a lot like aphthous ulcers, which makes it tricky, but it's the systemic features that point you to the real diagnosis. So yeah, the most accurate answer here is Behçet's disease. All right, that's it for this case. I hope it helped you think through how similar lesions can show up in very different conditions. Always zoom out and look at the full clinical picture. Thanks for watching, and I'll see you in the next one.